Cis-diamine dichloroplatinum 2, also known as cisplatin, is a bright yellow coordination compound and one of the most commonly used drugs used in immunotherapy cancer treatment. It consists of two adjacent amine groups and two adjacent chlorines bonded to a platinum 2 plus cation in a coordination complex. Since platinum is a D8 metal, it forms square planar coordination compounds, which can have two stereoisomers, cis and trans, where the two like groups are either bonded adjacently to each other or across from each other. This compound is of the cis conformation, hence the name cisplatin. Cisplatin is synthesized in a three-step reaction starting with potassium tetrachloroplatinate. When reacted with potassium iodide solution and ammonia, the chlorines are replaced by two amine groups and two iodine atoms, forming the dark yellow compound cis-diamine diiodoplatinum 2. The cis-diamine diiodoplatinum 2 is reacted with silver sulfate solution, which causes water molecules to replace the iodine. The final reaction has the cis-diamine diaquaplatinum 2 reacting with excess potassium chloride to produce the bright yellow cis-diamine dichloropplatinum 2, also known as cisplatin. Although cisplatin was discovered in 1844 by M. Perron and known as Perron salt, it was Alfred Werner who determined its coordination structure. However, it was Barnett Rosenberg's experiments at Michigan State University in the early 60s with E. coli that demonstrated cisplatin's ability to elongate cells. He was growing E. coli in an electrical current. However, the platinum in the electrodes reacted with the solution that they were growing in to form cisplatin. The newly formed substance damaged the cellular DNA, so that E. coli could only grow in size, but it couldn't divide. Rosenberg put cisplatin to the test by injecting mice affected by the sarcoma 180 tumor with the drug. He also tested it on mice with the L1210 tumor, in which the drug was administered via four methods: oral, intravenous, subcutaneous, and intraperitoneal. The four methods were used in Rosenberg's experiments in order to determine which was the most effective at eliminating the tumor. As demonstrated by the following table, the drug was administered to the mice for 5 days using the four different methods. Intraperitoneal method was the most effective, followed by subcutaneous, then intravenous, and finally, administering the drug orally to the mice was the least effective method. Rosenberg and his research team decided to move on to testing humans in 1973. They administered the doses of cisplatin on patients who were also undergoing radiation therapy as well, and like the mice, the humans who received doses of cisplatin showed signs of improvement. The drug was especially effective in testicular and ovarian cancers, although it was helpful to patients with other types of cancers as well. Unlike the experiments done with the mice, the testing done with humans demonstrated that intravenous injection is most effective at stopping tumor growth in humans. As demonstrated by Rosenberg's E. coli experiment, cisplatin prevents the growth of tumors by interfering with their cell division. Cisplatin operates by diffusing into the nucleus of the tumor cell, and it forms adducts with the cell's DNA without inhibiting any precursor molecules. When the cisplatin is in the body, it undergoes a series of reactions, with the rate-limiting step being a substitution reaction, in which the chlorines attached to the platinum are replaced by water molecules, and it forms cis-diamine diaquaplatinum 2 cation, a weak acid. The series of reactions allows the cisplatin to form cross-links that prevent DNA repair and ultimately cell division. A recent study at MIT was done to determine whether or not types of biologically abundant molecules, such as carbonate ions, prevent the DNA from forming fully functional cross-links that prevent cell division. The experiment demonstrated that carbonate ions can inhibit DNA binding, since the cation binds strongly to carbonate anions. Although the cation is still able to form bifunctional cross-links that unwind the helix enough to prevent DNA repair. As demonstrated illustrated by the following diagram from Cisplatin. Chemistry and biochemistry of a leading anti-cancer drug. The formation of DNA crosslinks prevents many DNA-binding proteins from performing their assigned function. As a result, the tumor cell will undergo cell cycle arrest and eventually extinct. Cisplatin has proven itself to be extremely effective in treating non-small cell lung cancer tumors. The New England Journal of Medicine reported a study done by the National Cancer Institute of Canada on 482 patients with resected non-small cell lung cancer. The patients were given a treatment of cisplatin plus vinorelbine or underwent observation. This study proved that the patients given the cisplatin and vinorelbine treatment had a greater chance of survival and recovery than those who were only observed. In fact, while the average patient who received the cisplatin treatment survived 94 months after the experiment, the average patient who was only observed survived only 73 months after the experiment. Bladder cancer is another type of cancer that is commonly treated with cisplatin. The University of Erlangen in Germany did a study on 112 patients who had undergone surgery to remove a T1 bladder tumor and were given a treatment of cisplatin plus radiochemotherapy and 5-fluorouracil. After the experiment, 99 of those patients who received treatment did not relapse, and 80% of the 112 patients maintained good bladder health after their surgery and treatment. Ovarian cancer, which affects approximately 200,000 women a year and has a survival rate of less than 50%, is another type of cancer most commonly treated using cisplatin. Unfortunately, many ovarian cancer patients have developed resistance to cisplatin and other platinum cancer drugs and have been unable to be treated with the drug in recent years. Resistance to cisplatin is not the only problem that patients have encountered while using cisplatin. Like other chemotherapy drugs, cisplatin carries toxic side effects to normal cells as well as tumor cells. These toxic side effects have been studied in dogs, rats, and monkeys, and range from intestinal damage and vomiting to loss of appetite. The effects that have been observed in humans have been deafness, loss of appetite or starvation, and damage to the proximal convoluted tubules of the human excretory system. Ironically enough, cisplatin is also a known carcinogen, and has been known to cause the formation of lung adenomas and skin carcinomas in mice. Although cisplatin has encountered bodily resistance and carries toxic side effects, it is still being used as a fundamental chemotherapy drug, and researchers have been discovering ways to prevent resistance. For example, adding arsenite to cisplatin can help prevent resistance in ovarian cancer treatment, which has been a problem for years now. Up until recently, cisplatin was effective at eliminating non-small cell lung cancer tumors. Patients with small cell lung cancer tumors could not be treated, because small cell tumors would usually be highly resistant to chemotherapy drugs containing platinum. However, research has shown that upregulation, in other words, creating more copies of the FAST gene, which is involved in apoptosis, can help eliminate small cell tumors. Because the expression of FAST, VAX, and other pro-apoptotic genes is very low in small cell tumors, the tumors are unlikely to undergo programmed cell death, and as a result, cisplatin did not have much of an effect on these type of tumors. Since cisplatin has been used in combination with other treatments in the past, scientists are combining cisplatin with other methods to avoid problems with platinum resistance. For example, cisplatin has been combined with pemetrexed, a chemotherapy agent that inhibits enzymes in the folate pathway in order to eliminate tumors in non-small cell lung cancer patients. Also, many cisplatin-resistant tumor cells express high amounts of SIRT1, the histone deacetylase, that plays a role in DNA repair. This enzyme also alters the metabolism of tumor cell mitochondria, and as a result, these tumor cells have a decreased uptake of glucose compared to normal cells. Studies have been done on mice with a BRCA1-associated breast tumors that demonstrate how cancer stem cells, which are capable of maintaining continuous growth, are able to maintain tumor growth due to their high resistance to chemotherapy drugs. These stem cells also exist in glioblastoma tumors, as well as small cell lung cancer, which express high amounts of drug-resistant genes such as CD44 and MDR1. By identifying these stem cells, scientists believe that they will better learn how to eliminate their resistance to cisplatin and thus eliminate the tumor as a whole. Finally, copper-1 binding chaperone proteins such as ATOX1, ATP7A, and ATP7E have been shown to play a role in cisplatin resistance. In a study done by Northwestern University, researchers used crystallography to examine the dimers between cisplatin and the ATOX1 protein, and helped prove that cisplatin is rendered inactive when bound to the copper-1 binding site on the chaperone. In conclusion, cisplatin has played an enormous role in the war against several types of cancers for the past 4 decades. Although cisplatin resistance threatens to make the drug obsolete, research in recent years has proven that cisplatin is still as useful now as it was in the 60s, if not more so.